Welcome, Dan Williams, Survive Outdoors. Today we're going to readdress my bug out medical kit, base camp kit. We're going to go through everything in more detail, and then I'm going to list below everything I have that's in the kit. It is not comprehensive. There are things that you may want to make a suggestion and add that would be awesome and helpful. I'm going to also attach the video. This is what I carry on every hike, on weekends, whatever. This little bag contains everything that I would need. I also have that video that I'm going to put down below. So today we're going to go with, this is actually called a bug out roll. CanadianPrepper.com is where you can purchase this. So they have different colors. I got the camo because it was on sale. I think it was like $120, but you're going to see it's really nice because it's see-through. It's got these pockets in it, and we're going to get into that. So let's do that right now. It's got these snaps, and we roll it. You can hang this also, which is great, onto a tree or wherever you're at on the side of your vehicle. This is not something that I carry, obviously. So, one of the things I want to mention is that you're in a situation, I don't care if you got 6 months experience, 5 years experience, 20 years experience, there's always going to be an adrenaline rush if you're in an emergency situation. So you want to try to put things back after you got things squared away and contained and people stabilized. You want to make sure you put everything back, and then when you get back home, you want to replenish your kit. Really important, because if there's an emergency, you flip this out, you're not going to know where things are at. It's one of the things I like about having these clear pockets with very heavy-duty zippers on here. So up here, I have some injectables, which clearly probably 90% of the people on this, my subscribers are not going to be able to have or use. So I have my lidocaine with and without epi here, some alcohol wipes and some needles, some miscellaneous Band-Aids and gauze. Also have in here some Steri strips. And I have some Silvadene. Silvadene is the classic burn cream. You can also use it for open wounds. However, if you have an allergy to sulfa, this is a no. And then you're going to want to use some Bacitracin. So, and then I have a few different types of tape. This is Medi-Rip. You can get this at Walmart. It comes in various colors. It's also called Coban. Hartman Corporation makes this specific brand, Hartman. Then we have paper tape, which is really nice. That's not paper tape at all. Actually, I thought it was. So this is more of a durable tape. Paper tape is one you want to use if someone really has an allergy to latex. This is a very strong tape. It is not paper tape. It looked like it. Then I have over here, this is kind of my favorite, sticks really, really well. 3M, it's a transport tape. It does have some breathing ability, so when you put it on, you're not going to, if you can see the little holes through there, it's really nice. You're not going to get the maceration of skin if this tape stays on for a long period of time. So that's in the top 3 pockets. Down here I have some of my instruments. I also have some suture material. So for my providers out there, I try to carry some 6-0 nylon for facial lacerations, fluoroproline if I don't have a stapler, and that fluoroproline is going to be used for scalps and over joints actually. And I have some other miscellaneous instruments I've purchased over the years. Some heavy-duty scissors. And this is a Kari, a Bovie, and it's really nice for basically stopping small bleeders, as well as putting a hole through your nail. Press that button, it gets really, really red hot, and then you can just drill a hole right through the nail. So that one, as you think I just saw, is, let's just double check. Yeah, so this is basically depleted. So good we used it. We're going to throw that out and I'll have to replenish that. So that's what this is. All right, so let's toss that aside. And over here I have some miscellaneous bandages. Let's pull them out, see what we have. Got alcohol wipes, some iodine wipes. I have some 4x4 iodine swabs to clean wounds. And we have some syringes in here. Now when you use Steri strips, and it's on one of my other videos, I'm going to show you, when you use Steri strips, it's really nice to use some benzoin. Benzoin, you take this, you break it, and what you'll do is you'll put it on each side of the wound, take your Steri strips, and it really helps for that to adhere better. And then we have a digit tip protector, and you can use sticks, you can use bark. You got to be creative when you're in the outdoors. You can purchase these also online. They are inexpensive. I'm going to have a medical kit that I am going to put together. You're going to see those where I'm going to have a stapler. I'm going to have some digit tip protectors, some of the bandages directly from the factory where we use them every day. And it's going to be really nominal. I have not got that together yet, and part of the reason is I'm trying to find a low-cost bag, and I may not find that for you guys, so what I'm going to probably do is end up putting the material in a regular plastic Ziploc bag to cut the cost for you guys. I don't want to be making tons of money with that. So what I'm going to be doing is put all this in the bag, and I'm looking around anywhere from a $10 to a $12 cost to you guys. And in that will be some of these, a stapler, a staple removal tool that you can remove the staples if you need to. All right. So in this compartment I have my meds. You'll see I have in here Pepcid. That is my own personal use for my gastritis, but that is not an H2 blocker. What you want, if I show you what's in my weekend pack, and you'll see I have my ibuprofen and diphenhydramine, and we went through this. I also have Pepcid. Pepcid, Tagamet. You want a H2 blocker for bee and wasp stings, as well as an H1, like your Benadryl, your Zyrtec, so on and so forth. And like I said earlier, the video for this little pack is going to be down below. So you'll be able to see everything in here, and I'll explain why I use what I do. Antibiotics. When I've had a few missionaries, for example, heading out to South America, Africa, and I set them up a lot of times with certain antibiotics, and they know what to look for in terms of their symptoms. Doxycycline is one, hydrochloroquine in case of malaria. Doxycycline is good for certain areas for malaria, not all, but you got to be careful with doxy because you can really easily get sunburned. Traveler's diarrhea, Cipro. So some of the antibiotics that I would suggest that you carry on a 7-day or greater trip, especially overseas, is Cipro, Doxycycline, a Z-Pack, azithromycin is really nice. It's 5 days, continues to work for 7 to 10, and it's only like, 4, 5, 6 tablets, and that's really nice to have in your pack. So certain antibiotics, and I'll list those below, which ones I feel are important, especially going overseas. So nice to have those with. All right. Now, again, you're not seeing Benadryl, you're not seeing my Zyrtec, and the reason why you're not seeing that is because it's in my everyday carry, that little bitty gray pouch, and that video, like I said earlier, is going to be at the end. And in here, again, we have more tape and more Medi-Rip. And down here, Afrin, and we've talked about that. This is not Afrin, this is Equate. It is the equivalent of Afrin, and the ingredient that you want is the oxymetazoline right here. Hydrochloride, 0.05%. And what that does is a vasoconstrictor, and I've specifically spoke about how this is really useful, especially with little kids and they're bleeding, they're freaking out. You take a little 2x2, 4x4, spray some of this on it. You can even spray it in the wound. Stick it on there, put some Medi-Rip. It's going to help tremendously to stop the bleeding. I have some sterile gloves in here, plastic bag, and we talked about irrigation earlier. And you always want to have, again, in those little, I bought a bunch of this wholesale, Adaptic. Adaptic is really nice. It's a non-adhering dressing. You bandage someone up, they're bleeding pretty bad, and you're 5 days from getting back. Now you're going to change that bandage, and after 3 days, you're 2 days, you're going to take that bandage off, the blood has dried, and you don't have Adaptic. Well, your buddy's going to remember you. All right, it's going to dry up, it's going to hurt like hell. And Adaptic's really nice because it's just non-adhering and it won't stick. So I really advise you to keep some of that in your bag. What else do I have in here? Benzoin, Steri strips, some Steri strips, Adaptic, Xeroform. It is all that is a petroleum dressing. Very similar on the same vein of Adaptic. Again, let's just look at this. I'm going to show you real quick. This is pretty self-explanatory. You can see it right through the packaging. Xeroform is petroleum-based gauze. Really nice because you can take that for a fingernail or an injury and it's not going to stick to the wound and it's going to keep it clean. So if you can pick you up some Xeroform, that's nice to have. Just wipe that right on your pants. All right. What else do I have in here? Gauze, nothing new there. All right. I'm going to put that Equate in this one. All right, let's go back down to the bottom two. And I have a drape, sterile drape, in case I have to stitch somebody up and I want it fairly clean. I got some gloves and a staple removal tool, instrument. This is going to remove the staples. And you are going to get that in that little plastic bag that I talked about when I get that set up. And at the very bottom one, what I have is a lot of gloves, basically a towel, some Adaptic, more gloves. Now, you cannot have too many of plastic gloves. You're going to go through, if you have a trauma on your hands, I am here to tell you at least a half a dozen times you're going to change gloves. I was coming home from work and on a back road I had a motorcycle, that bad accident. I was second on the scene, so I bet I went through 8 pairs of gloves with that gentleman, and he made it. He was really banged up. He ended up having I think a C5 fracture in his neck. He had a lacerated liver, massive scalp laceration, peeled back, clear concussion, very bad shape. But again, you're going to get your gloves bloodied up and then you forgot something in your pack and you have to get something else out to bandage. So you peel those gloves off, you get another one. So that's the scenario. So you can't have too many of these, and they're very lightweight. So don't pack a couple pair, okay? Pack a bunch. And that's what I have in this. And like I said, in this one, this is my everyday carry. You can say every day, but it's in my backpack. It's what I would do on a weekend, and this has really a lot of the meds from the Benadryl, the Zyrtec, some Pepcid. It has some Bacitracin, bandages, aspirin. My aspirin is in here. You're going to wonder why there was no aspirin. So aspirin's in here, chest pain. This is the one. So, and that video will be down below. So that's it. That's my base camp, if you will. My wilderness medicine kit stays in the car 98% of the time. Be awesome if it stayed in there 100%, right? It wouldn't need it. I hope that helps for the people that wanted the specifics, and it'll be all listed below. So thanks a lot. Oh, coming up, I got to tell you this. I have a very interesting Lyme disease case. It really threw me a curveball. We got it figured out, but it was really an interesting case. That video is coming up. I have a very interesting rash video coming up, as well as some unique fractures. So those are coming up in the future. So keep your eyes on the horizon, your face to the wind. Don't forget to subscribe if you like this. Take care.